joined this afternoon by, of course, to my far left, Dr. Dobbs, who has been right by my side throughout the last year dealing with COVID. We also have Dr. Meredith Travelstead immediately to my left, and of course, Dr. Clay Hayes, which many of you have met over the last year as he's played multiple roles in helping us deal with the coronavirus. We continue to make significant progress in our fight against COVID-19. Today, we are here to talk about something very, very important. In our view, one of the main tools in our toolbox left to deal with COVID-19, and that is potential more vaccinations. Mississippi has administered over 1.34 million vaccines, and over 500,000 of our fellow Mississippians are fully vaccinated. Nearly 900,000 Mississippians have received their first shot, and we continue to add more and more each day. On average, between 25 and 30,000 additional shots each day. In addition to seeing these significant numbers of shots going in arms, our COVID cases, as well as our hospitalizations, continue to plummet. Right now, our 7-day rolling average of new cases is just barely above 200, which is over 90% down from our peak of around 2,400 cases in early January. In addition, hospitalizations are down 88% from our January peak. We are now down to 163 Mississippians currently hospitalized with COVID, and that's down from a high of 1,444. ICU utilization and the number of patients on ventilators are down 85% from their January peaks. ICU utilization has gone from approximately 360 patients down to approximately 52. And the number of patients on ventilators in our state is now down to 35 patients, down from a peak of 230. As we continue to see the light at the end of the tunnel, you all have heard me say that when the vaccines first became available, that while the light was too far away, that we did see a glimmer of light at the end of the tunnel. That light is getting brighter and brighter, and the tunnel is getting shorter and shorter. However, as we move forward, I cannot express how important it is that these rollout of the vaccines continue to ensure that we can return to more and more of a sense of normalcy. With summer quickly approaching, it is important that we remain vigilant against the virus and continue to take necessary precautions when necessary. In recent days, we have heard calls from some in Washington to re-implement burdensome mandates and to shut down our economies in the wake of rising cases in other states. But we're not going to do that in Mississippi. The reason we're not going to do it in Mississippi is because the data does not justify it. I'm very proud of the progress Mississippi has made. I'm very proud of all of the people who have worked so hard over the last year. Obviously, these three docs sitting beside me at the table represent literally thousands and thousands and thousands of healthcare heroes who have done tremendous work throughout. I couldn't be more proud of the Mississippi Emergency Management Agency, the Mississippi Department of Health, the Mississippi National Guard, and so many others across the state at how much they have worked and how well they have represented our state through the vaccination process. I'm optimistic that we are near the end of this road, but I also know that for us to continue towards the right path, we need more and more of our fellow Mississippians willing to get the vaccine. As I mentioned earlier, 900,000 Mississippians, nearly 900,000 have gotten at least their first shot. We've got literally tens of thousands of additional appointments scheduled. But as I travel and listen to people around our state, I understand that there is still some vaccine hesitancy. There are still some people. Now, it started in early January. It was primary amongst those in our state that are in more rural areas, primarily amongst our African American population. And we've worked hard every day to educate people across the state. Today's event is really just another opportunity for education purposes. I wanted to hear from some of our state's leading physicians on some of the questions that you all may have. You may have said, I just haven't quite been ready yet to go get that shot. I've heard that from folks. Now, with that, I want to begin today's remarks with, if we could, with Dr. Clay Hayes. Dr. Hayes, if you would just remind everyone the practice of medicine that you have and a former state medical, I don't know what y'all call it, president, CEO?
Yeah, president.
Former state medical president.
Right,
and
thank you.
Been very involved, so if you would.
Sure. So I'm a cardiologist here in Jackson and enjoy practicing medicine. I was seeing patients this morning and this afternoon and see a lot of patients with those sort of questions. As cardiologists, patients are always concerned about having a heart attack. And there has definitely been an uptick in heart attacks around this COVID environment. And a lot of that has to do with people afraid of going initially was afraid to go to the hospital because they thought they were going to get COVID. And so they were staying at home having heart attacks because they weren't going to get medical care. And this is sort of the same idea, is they need to go get the care that they need, particularly the vaccines. Now, people question, well, do they have blood clots or something like that? Well, there has been a little higher rate of blood clots in patients that have COVID. And so the idea is if they get the vaccine, their chance of getting blood clots theoretically goes down. And so we are encouraging patients to get the vaccines. I know I've had my vaccine. As I was telling Dr. Dobbs earlier today, 86% of the healthcare workers at St. Dominic's have been vaccinated with at least one shot. And so as a medical community, we believe in the vaccine and we're going to continue to encourage people to get it.
Well, great. Thank you, Dr. Hayes, for being here. I really do appreciate it. Dr. Meredith Travelstead, will you give us a little bit of your background, please?
Yes, I'm an OBGYN at the Women's Clinic here in Jackson, and I've been in practice for 20 years now.
Well, great. I know we're going to have some great questions. Dr. Dobbs, I don't think you need to introduce yourself to the people at this event, but if you would just give us a little bit of a background and kind of where you think we are.
Yeah, well, since we're talking about the clinical part, I'm an infectious disease specialist and treated infectious disease issues and had patients up until 2 years ago when I took this job, and I do miss it somewhat, seeing patients directly.
Now I'm your only patient, right?
No, but we're making great progress. Our numbers are down. We're able to do more. It's fantastic to be able to be active outdoors. I have a lot more time on the weekends, and I'm much appreciative of that. But it's also an opportunity. We do have some, it's not that we're out of the woods, we have the light at the end of the tunnel, but we also have a train behind us. And we may want to go ahead and get as many folks vaccinated right now while our cases are low. And we also have variants around the corner, right, that may give us some challenges. But we're very pleased, especially with the Pfizer vaccine data that just came out, that it has a lot of retained potency even against the South African variant. So, we're doing great, but we have challenges ahead, and we have a great solution with vaccines available.
Right. Well, Dr. Dobbs, let's start with that. Let's start with the process of getting these vaccines. As I appreciate it, we now have 3 vaccines available from 3 different companies. Chase, through social media, had asked me talk a little bit about the approval process and really FDA approval versus the EUA and the emergency use authorization and sort of kind of how that works.
Yeah, that's such a fantastic question, and I think it's really important to kind of speak to what is the process for getting these vaccines approved. I think it's important to talk about the innovation that happened under Warp Speed, where they did one thing that was really brilliant, and they basically did production and clinical trials at the same time. And if the clinical trials, the studies on people, didn't look like they wanted, they would just throw the vaccine away, right? Normally, you'll do your trials, and then you'll have a bunch of investors figure out if it's worth investing in and all this other stuff, and you build factories, and then you have all this time for production. Well, it was wise, and the government just purchased it and said, let's do the research and the production at the same time so we're not wasting any time, which was very, very smart. The other thing is after the studies came back, they went through this EUA process, or Emergency Use Authorization. But I want to emphasize that what they did is they cut bureaucratic red tape. They didn't cut corners. And making sure that it was so important that they put all the resources into looking at it very closely and very critically. The number of people who were in the studies was at least as many or more than many other vaccines that have been approved. So the process was expedited, but it was thorough, but it was efficient, but it wasn't anything that cut any corners.
We were talking earlier about the technology that was used in the 3 vaccines, and that's a question that I sometimes get. Is this a new technology? And Dr. Hayes and I were talking about the mRNA technology, and that really in his field, there's a number of different medicines that are allowed that use similar technology. Is that right?
That's exactly right. So we talk about mRNA technology and trying to sort of fool the body into developing an immune response. Well, the same thing we do a lot of research at Jackson Heart, and so cholesterol medicines, some of the newer cholesterol medications, we use the same sort of research platform to develop new cholesterol medications. And so, we're familiar with this, and so we're not afraid of the way vaccines are being produced. That's just part of the research process. So we feel very good, and we feel like the vaccines are very safe. Haven't seen, oftentimes we'll have an estimation of how many people will have a problem. Well, the actual reality that we're seeing in registries is a lot lower than what's being forecast to be a problem. And so that's just part of the research process, which is good.
Right, and my impression is, I talked to someone in the pharmaceutical space not too long ago, and when you look at most of these clinical trials, certainly with all 3 of the vaccines, they're literally utilized 30, 40, 50,000 individuals, and as I appreciate it, there are a lot of drugs on the market today whose clinical trials were much, much smaller in terms of the total number of individuals that were out there. Is that correct?
Yes, sir. Absolutely.
Well, great. One of the questions that I got from Melody, which I thought was really interesting, and I want to, before I ask this question, I want to make sure everyone understands. There's all this, all these numbers that are thrown out there where they're only 10% of the people are vaccinated, only 20%. So here are the real numbers in Mississippi. We have 2,976,000 Mississippians, and that's on the 2010 census. It's probably about there, maybe slightly below, but let's just say 2.976 million. Of those, I would submit to you that somewhere between 550 and 600,000 are under the age of 18. Now, there is a couple of these vaccines have the ability for those over the age of 16, but just for our purposes, I just want everyone to understand that we have about 2.2 to 2.3 million Mississippians that definitely fit in the category of being eligible for a vaccine. That means they are, in my mind, over the age of 16. They don't have not had significant reactions to vaccines in the past, et cetera. So when I think about how many can we actually get vaccinated in Mississippi, if we got 100% of those who are eligible right now, it'd be between 2.2 and 2.3 million. We've done 1.34 million shots. We've done just under 900,000 of that 2.2 million that have gotten at least one shot. So you're really looking at between 35 and 40%. And we've got a little over 500,000, or about 550,000, that are fully vaccinated now. So we're really at, right now, about 25% of Mississippians are fully vaccinated. And somewhere in the neighborhood of about 35 to 40% have received at least their first shot. So when we talk about our goals, I want to just be clear that we're looking at having this conversation today so that we can really figure out what we can do to continue to encourage those to get the vaccine. We hadn't had this conversation before, in large part because we found ourselves in a position in which literally for December and January and February and all of March, we had significantly more demand for the vaccine than we had supply. Well, two things have happened. One, we've gotten 1.34 million shots in arms, so there's a segment of the population that is behind us. The other thing that's been happening at the same time is that we've seen supply increase as you would expect on a weekly basis. As Dr. Dobbs said earlier, the federal government under the previous administration, under Operation Warp Speed, they went ahead and they started doing manufacturing of vaccine before they knew if it was going to be safe or not. That meant that some of them got thrown out because some of them have not been approved yet. But it also means that we were able to get started months and months and months quicker than we otherwise would have. But we always knew that once the EUA occurred, that the delivery of those vaccines would increase more and more on a weekly basis. Well, that's where we find ourselves today. And now, as we get into April, and certainly as we get in towards the latter part of April and the early part of May, what we find ourselves with is a scenario in which maybe we're going to flip that corner where demand no longer significantly exceeds supply, but supply maybe exceeds demand. And so we want to make sure that everyone has adequate information to make a wise choice for themselves to get the vaccine if they think it makes sense. Meredith, one of the things that has certainly been discussed, and Dr. Dobbs, you may want to jump in here as well, is there's been certainly vaccine hesitancy amongst younger females, and particularly as it surrounds reproduction, because throughout this process, there's been lots and lots of rumors on lots of topics. But this is one that actually really caught hold, I think, certainly on social media, et cetera. And so I just would really like for you to at least talk through some of that and give us your thoughts.
Thank you, Governor. I'll give you an honorary doctorate.
I got a promotion today. This is great. I'm going to have you here more often.
Thank you, Governor, and thank you for your support of our medical community. So this conversation is every day in clinic for me, is who should get the vaccine? Can I get the vaccine? Is it safe to get the vaccine in pregnancy and breastfeeding, and also in planning a future pregnancy? And a lot of that surrounds how the vaccine first was rolled out and how the studies were first done. In the patient population, they did not allow pregnant women and breastfeeding women in the study. However, there were, in the initial studies for the vaccine, however, there were some who spontaneously became pregnant that they have followed through the process, and they did not find any untoward bad outcomes or problems with their pregnancies. And then after that, they have since that time, the American College of OBGYNs and the American Society of Reproductive Medicine have promoted vaccinating pregnant women and breastfeeding women, knowing that this is the type viral vaccine that can be given to pregnant women. We know there are some vaccines that you don't receive during pregnancy and some that are attenuated or not live viral vaccines that are safe to give in pregnancy, like the flu vaccine and the pertussis Tdap vaccine we give during pregnancies, that to give our moms and our babies some passive immunity because of those vaccines. And so we know this is the type viral vaccine, a non-replicating viral vaccine that can be given during pregnancy. However, there's still a lot of concern because we have patients all the time that say, well, they didn't study it in pregnant women, they didn't study it in breastfeeding women. So there was a lot of concern about how the vaccine was made, how it was rolled out, how rapidly it was studied. But as time has gone on, we have more and more of a population of healthcare workers and frontline workers and patients that have gotten the vaccine during pregnancies who have been studied and who have agreed to sign up for the CDC's V-Safe, Vaccine Safe app, where they tell their symptoms, they tell their outcomes in their pregnancies, and they have a database of about 30,000 pregnancies. And so far, compared to just the background risk in the population, they haven't seen increased stillbirths, increased miscarriages, other complications, anomalies in the pregnancies. They have not seen any increase compared to the population. So we can feel better about pregnant ladies getting it. It's still a personal decision, and we encourage patients to have the conversation with your physician, talk about it, ask questions. We had to study it. We studied it. We go and get to the journal articles, the NIH, the CDC, and we do a lot of research ourselves. So do have the conversation with your doctor about it. But we feel better and better as time has gone on about the safety of pregnancy. And then breastfeeding as well. They're doing studies on breast milk, and they found encouraging findings of seeing the antibody response and giving moms showing some passive maternal antibodies that protect the baby and going into the breast milk. And they know that this is the type viral vaccine that cannot cross the placenta. You know, the big part of the research was being able to get this little code. The code is the mRNA, protected long enough to get it into our cells before it degrades. And that's the big thing I tell patients when they realize how rapidly it degrades. You know, there's a lot of internet information about it's going to change your DNA, or it's going to make you into some different form, or it will pass on to your baby, but it's not going to cross that placenta. It's not going to code for a different DNA. This is the step beyond DNA. It doesn't go into the nucleus. Remember your biology, the DNA in the cell and the nucleus, but it's the code after that that codes for proteins. So it's only one step further than most vaccines are in giving you the protein to have a response. This is the code which allows your body to make the proteins, and it rapidly degrades. So that's encouraging to know for pregnant moms, to know that it's not something that is going to stick around forever, that you're going to be sending across the placenta to your baby, and you can feel better about getting that vaccine and then getting it breastfeeding. Now, the other issue was infertility. I have had a lot of patients ask about internet rumors that this will cause infertility, and how do we know that it's not going to affect my ability to have children 10 years down the road? Well, part of the reason that came about was the mRNA code that we use. They saw some common parts of that code that were similar to the placental proteins, some of the placental proteins. But when they really continued to study this, it was not the whole code for a protein. So you don't see an antibody response to placental proteins like you do to the spike protein of the virus. And that was a concern, because we thought, well, maybe we would cause an antibody response to the mom's placenta and cause miscarriages and infertility, but that has not been the case. And when you compare that to a whole year's worth of data with COVID infections, we haven't seen an increase in infertility, and that's borne out nationally and internationally. We don't see an increased infertility rate. So when you think about COVID in pregnancy and how bad it can be, it's going to be at risk to increase your ICU stays, your maternal morbidity such as pneumonias and intubation, more complications, more hypercoagulable, increased blood clot risk in mothers, more preterm birth. That's the known. I always talk about patients' fears. You know, it's with the vaccine, it's the fear of the unknown. But with the COVID infection, we have a lot more of fear of the known things that we've seen over the past year versus fear of the unknown and trusting this vaccine. So I think you have to look at the overall picture, comparing the known of COVID infections versus the unknown of a vaccine and what we have seen in research so far.